Welcome everyone to another wonderful episode here at Doctors of Podiatry. We find ourselves here in our office-based surgical suite. We just finished a minimally invasive surgery for something that a lot of people battle. And some of you may not think this is a really compelling video, but it really is. Young patient, 27 years old, has been battling, presented to our office with an ugly, painful toenail, which has been present like this for many years. Something that a lot of people out there in this world battle. Whether it's related to fungus, whether it's related to trauma, whether it's related to whatever. The patient had an ugly, discolored, painful toenail. It looked like Mount Everest, kind of like this. So what we decided to do, we decided the two-phase approach. Number one, elimination of pain. We decided to remove the nail plate in its entirety. That we did last week. Okay. Phase two, at the core. Again, our job is to identify the core of the problem. We took x-rays. Caesar. This is a lateral view of the great toe. Okay, we're looking at the side view. The great toe has two bones, 1 and 2. Over here, right, anytime, and you guys can actually see kind of like the shadow here of the nail, and this is the nail bed right here. Look how close this horn, right? It looks like a rhinoceros horn. This horn is so close to the nail bed. So this, until proven otherwise, right, this structural abnormality, what we call a subungual exostosis, also known as, we'll make believe it's a bone spur, pebble. So this was actually causing the pain. If you guys can imagine the nail up here pressing down on this, that can definitely create a lot of pain. Not only pain, but dystrophy, thickening of that toenail. So what we decided to do is eliminate the rhinoceros horn. So that's exactly what we did today. What we did was, it's a minimally invasive little procedure. It took, how long did it take? 7, 8 minutes, maybe? 20 minutes since we started, but it was probably, the procedure itself, honestly, it took like 10 minutes. So what we basically did was we shaved, we remodeled everything. Come, let's take a look. And this is the after. As everyone can see here, obviously the horn is not there. Okay? So we make a tiny little incision. I'll show everyone now, a little incision here, and then we just basically erase the bone. That's it. We gave the bone a haircut. And a lot of clinicians, it's really important out there when I say do your homework, and when you go see, doctors, and if you are specifically the great toe, this happens a lot in the great toe. If you go see a doctor, you have an ugly, thickened toenail, maybe, and you have maybe superimposed fungus, get an x-ray. Tell the doctor if they don't recommend it, say, hey, by the way, can we get a lateral x-ray? Can we get a side view to see if there's a bone spur? They're going to be like, wow, this individual has done their due diligence and homework. So basically, it's really important. Again, it's a one little suture procedure. As everyone can see, the nail bed is clean and healthy. It's a little bit, we'll say the nail bed is a little bit atypical. What I mean by that, that's called blood, that's normal. There's only one little suture there. The nail bed itself is actually very damaged. It's very fragile. It has suffered tremendously throughout the years. It's not your typical, like, really pretty nail bed that is nice and flat. You guys can clearly see, even from the side here, Caesar, you guys can really see how, it has definitely suffered. So this is a great procedure for a lot of great reasons. So now what we basically, what we're going to go ahead and do, the patient already started the course of the oral terbinafine, which is the oral Lamisil. We're not going to talk about the protocol for either, possibility of fungus, and so on and so forth. Do your homework, ladies and gentlemen. Do your homework, right? Do your homework. No one will ever tell you, why did you? Do it. Just a quick recap. Dr. Wagner, what did you do here today? we removed a bone spur of the last bone underneath the nail plate. We removed it because at the core, that is definitely a contributory cause to the development of the initial clinical presentation, which was a nail that looked like Mount Everest. Have a nice day, everyone. Enjoy. Enjoy.
Enjoy what? The food?
Enjoy. So, sure, we'll do this as a blooper. No. Caesar's a little bit nervous today. So anyway, so let's try that again. Here we go. We're gonna continue to do what we do. We're gonna continue to educate the world, 1 foot, 1 bone spur, and 1 toe at a time. Is that good for you, Caesar?
I guess.
Boom!